A rare polio-like disease affecting children is on the rise here in the U.S., according to the Centers for Disease Control and Prevention. This disease is rare and can cause paralysis in the arms and the legs. What's even more worrisome for parents is doctors have yet to find a treatment for it. Here's RT correspondent Ashlee Banks with more.
A rare polio-like paralyzing disorder affecting children is on the rise, causing weakness, and in some cases, it has left children's arms and legs paralyzed. Between August 2014 and August 2018, the Center for Disease Control and Prevention received over 350 cases of acute flaccid myelitis, also known as AFM. Recently, 6 AFM cases were found in Minnesota. The state's Department of Health says in all 6 cases, the children were under the age of 10. This disease typically attacks the nervous system by traveling through the spinal cord, causing symptoms like sudden arm and leg weakness, drooping eyelids, facial weakness, difficulty moving the eyes, and slurred speech. There's a community group on Facebook with parents whose children are battling with AFM. They share their stories and seek advice from one another in hopes of tackling this rare disease. I spoke with Hannah McNeil, a Colorado resident who was just diagnosed with AFM last month.
You know, I'd never heard of any kind of disease like that before. Polio really wasn't even a thought. I went into the hospital just off of leg weakness. I had a cold for a couple days before that, but nothing serious. And I went in and went to the emergency room, and in the emergency room they had did a spinal tap and then diagnosed me with meningitis, and then that was when the talk of AFM had come into play.
The CDC says this condition is not new but has increased since 2014. The cause of this increase is being linked to a virus known as EVD68. What makes matters worse is the disease is difficult to diagnose, even with extensive lab testing. The disease is also very similar to other conditions like polio and the West Nile virus. Officials say they usually see less than 1 case a year. I asked McNeil if her doctors warned her about any long-term effects.
They said that there's so much uncertainty with what the recovery time looks like. They said that at 6 months to a year, your body's kind of going to plateau from your recovery. You're going to recover a whole bunch, and then it's going to stop because they just don't know anything. So I have the faith that I'm going to keep going.
In order to avoid infections, the MDH recommends parents wash hands frequently, cover cough, stay home if sick, stay up to date on vaccinations, and if outside, protect children from mosquito bites. At this time, there's no specific treatment for the disease. However, according to the MDH, local disease investigators are working aggressively to gather more information in order to stop it from spreading. In Washington, Ashlee Banks, RT.
Hey YouTube, thanks for checking out our channel. We hope you enjoyed the video. We have tons of content for you just like this. For more of RT America's one-of-a-kind news and analysis, be sure to subscribe and never stop questioning more.